Welcome everybody to a new presentation, and in this presentation we are going to talk about a subject that is faced by so many dentists, and this is the gag reflex or gagging and its control in oral radiography. Actually, it's not only in oral radiography. The gagging is common in all dental procedures, but today we're going to talk about the gag reflex itself and how to some hints to control it. By definition, gag reflex, sometimes it is called also as the pharyngeal reflex, and we will understand why. Gag reflex is a natural, involuntary reflex that involves the bilateral pharyngeal muscle contraction and the elevation of the soft palate. So it's a natural, involuntary reflex. This reflex may be evoked by the stimulation of the posterior pharyngeal wall. It could be stimulated by these, could be initiated by the stimulation of the tonsils or the tonsillar area, the soft palate, and the posterior 1/3 of the tongue. This reflex naturally it is made to prevent the swallowing of foreign objects and prevent choking. So it's a defensive mechanism, and the gag reflex could be somatogenic or it could be psychogenic. A somatogenic reflex or a gag reflex, it follows direct physical contact with the trigger areas, one or more of those triggered areas that are mentioned above over here, or it could be a psychogenic gag reflex which presents following a mental trigger. So there is no actual direct physical contact with the areas, like the thought of touching a sensitive trigger area. However, the somatogenic gag reflex is more common, at least in the dental practice. The psychogenic is a more severe form of the gagging reflex. The nerves which are responsible for the gag reflex, it is mediated by a sensory nerve, which is the glossopharyngeal nerve, and it is again mediated by the vagus nerve, which is a motor nerve. So there is involvement of two cranial nerves, which are the glossopharyngeal, which is the sensory part, and the the vagus, which is the motor nerve. However, if the effect of the trigger area is from the soft palate, then the trigeminal nerve will be involved in the area. A hypersensitive gag reflex may be caused by anxiety, postnasal drip, acid reflux, or oral stimulation, such as during the dental treatments. And lack of the gagging reflex or the gag reflex may be a symptom of a more severe medical condition. So it's not good actually not to have the gagging reflex, because otherwise this might be an indication of a cranial nerve damage, or sometimes it is a representation of the brain death. So it must be available. Gagging reflex severity, it has several grades as described by Dickinson and Fisk et al. It has been this research. The researchers have divided the gagging reflex into 5 stages, starting from the simplest, ending with the most advanced. The grade 1, which is the normal gagging reflex, This develops on rare instances during a high-risk dental procedures, such as making a maxillary impression, and it is controlled primarily by the patient. So most of the patients, actually, the grade 1 is a normal one. We don't see them with each and every patient, but in severe dental procedures, like making an upper impression, you might, the gag reflex might be initiated. Grade 2 is a mild gagging reflex. This develops during basic dental procedures, such as fillings, scalings, impressions, and the patient can generally retake control, but sometimes the gag reflex may require support and reassurance of the dental team. Increased severity or grade is the grade 3. This is the moderate gagging reflex. It is common during routine dental treatments. Physical examination of high-risk regions, the 4 areas that we talked about, the soft palate, the dorsum of the tongue, the last part, and the throat, and including the lingual side of the lower molars. This is now we're talking about the floor of mouth, and it may induce this reflex plus the aforementioned areas, and control is difficult in these areas once the operation has initiated, and there must be some gag reflex control methods that we will simply mention as we will proceed in the slides. Grade 4 is a severe gagging reflex, and it occurs with all aspects of dental treatments, regardless of its severity, including even the basic visual examination. Routine treatment sometimes is impossible without a specific measure to try to regulate the gagging reflex. The last one, which is the very severe, or grade 5, is a severe gagging reflex. It is it's a common reflex. It's always there, present. It doesn't require any physical intervention to activate. And dental treatments in these such type of patients, the very severe one, is almost impossible unless there is a particular specialized therapy for gagging. Actually, our patients range between grade 1 and 2 in most of the cases. As the grades of the difficulty increase, more measures should be taken to control the gag reflex. Now let's come to the control of the gag reflex in radiography. And when we talk about radiography, now we're talking about placement of a sensor to take a radiograph, whether a periapical or a bite wing, or an occlusal radiograph. And whether we're talking about a sensor, or with held by the patient's finger, or by a sensor holder. Both of them actually may initiate the gagging reflex. There are certain points which are, from my readings actually, I didn't find them that they are mentioned, and I would like to mention them now, though they are a bit, I don't know. The first of all is that for those who smoke, dentists, you should avoid smoking while you're treating a patient, or the moment you smoke a cigarette and then you start smoking, start treating the patient right away, because the smell of tobacco and the nicotine which is present in it on the dentist's breath and the fingers can make gagging, or can cause gagging even for a normal patient. And I think those of you who do not smoke can feel this. Dentists should avoid, and their assistants should avoid eating smelly foods that are smelled by the patient, especially, the dental treatment, we are very close to our patients, so smelly foods can cause gagging in some patients, or they may aggravate the gagging reflex which is present already in the patient. The personal hygiene to control or to get rid of the body smell is also important. I'm sorry to say this, but this is an important point. Smelly dentists and staff can cause smelly. I mean, bodies of the staff can cause gagging. So the control of the personal hygiene is really important. Now let's start about talking about the practical points. If you yourself as a dentist, you feel tired, your cooperation will be reduced and your toleration would be reduced as well. So if you are tired yourself, try to postpone the treatment so that at least you can be more passionate and you can negotiate or you can tolerate your patients. So try to work while you yourself are calm and can tolerate that pressure. I know that the dental practice is really cumbersome and it takes a lot of the efforts of the dentist, but again, if you are so tired or overwhelmed by work, try to postpone the appointment. Before you start inserting the X-ray film or sensor inside the patient's mouth, you have to turn your X-ray machine on, adjust the exposure time as per the tooth that you're going to take. You have to place all your infection control barriers on the X-ray machine and on the sensor. And you place your lead apron on the patient and bring the X-ray machine closest to the position that you can work with. The idea behind this is that we do not want to put the sensor inside the patient's mouth and then, of course, the sensor being intolerable for the patient, and then we start our X-ray machine and then we put the barriers and we put the lead apron and so on. What we want to do is that we want to keep the sensor the minimum time inside the patient's mouth. And this is assured or it can be made by taking all the necessary steps before insertion of the sensor inside the patient's mouth. Even if your patient has done an X-ray before, inform your patient, whether he is old or a child, about the procedure that you are going to do. Tell him, I'm going to put the sensor inside the mouth. This might cause some discomfort, so please bear with me because I understand that it might cause some I don't mention the gagging. Tell him that this procedure might cause some comfort. The idea is that the patient is going to be relaxed by the passionate behavior from your side. Your appointments should be short. Especially for endo, where we face the gagging most, long procedures for the patient can make him less cooperative. So please try to shorten your appointments so that you guarantee that your patient will be cooperative. And give the time, especially for a long procedure where the patient is going to open the mouth for a long period. This is going to increase the pain and discomfort and the muscles of mastication. So when you are going to do like a radiograph after a long time of mouth being opened, please give the time for the patient to relax the muscles. Because if you directly open the mouth after a long procedure, and then you put the sensor, you would expect that the cooperation of the patient will be less, and then he will be more prone to gagging reflex. A very important point, whether you're doing an impression, you're doing a cavity, whatever procedure you're doing, never mention the tongue to the patient. Never ask the patient to keep your tongue away from the area of the procedure, because this, and try it, I think you've all come across this, is that when you ask your patient to move the tongue, the tongue will just be involuntarily the patient is going to move the tongue, and sometimes the treatment you will not be able to complete the treatment. So please forget the tongue and never ask the patient to place the tongue away from the area of your work. Now, before you place the sensor inside the patient's mouth, don't put the sensor blindly inside the mouth. Please ask your patient to open, then have a look inside the oral cavity. If you look inside the oral cavity, you're going to acquaint yourself, you're going to know the anatomy of the area. Sometimes when we take the x-ray, especially for the posterior teeth, we just blindly insert the sensor on the palatal or the lingual surface of teeth. So please look inside the patient's mouth, see the area, so that you can maneuver. You will know how to insert and where to insert the area before you insert the sensor. Never, when you insert the sensor, never slide the sensor against the soft tissue. Never slide the sensor against the soft tissue. Sliding the sensor against the soft tissue will initiate gagging. As we said, gagging is a normal, natural reflex, right? So imagine if somebody slides his finger or her finger inside your mouth and try to put it against the soft palate. Actually, we do it sometimes ourselves. When we try to, to vomit, we will touch either the posterior third of the tongue or the soft palate. This will naturally give or initiate the gagging and then the vomiting, so that we will expel what is inside the stomach. So sliding or pressure on these areas will initiate gagging. Instead of sliding the films, you better, after you locate the area, you just put with a fast movement, you just place it behind the tooth, and that's it. Sliding will cause or will initiate gagging. So you better place the sensor in a snap movement after locating where the area you're going to put your sensor or your sensor holder. Sensors are not heavy, right? So you don't need to push hard against the soft tissues. Just hold them lightly, okay, and gently, and then just put them there, and that's it. There is no need to push hard against the hard tissues or work forcefully with the sensor. One point, and I think if you go back to the earlier videos about the placement of the sensors in the lower molar areas, if you feel the patient is tightening the floor of the mouth, which is again natural reflex, please put your fingers, suppose I'm working on the left side, and when I place the sensor, I find that this patient is tightening the floor of the mouth. All what you need to do is you place your fingers from the outer side, on the opposite side, and just ask the patient, please relax this area. So the patient's mouth will be, the patient's sensation will be changed from the area of the sensor inside the mouth to your fingers, and the area will be relaxed. And this is a good strategy for relaxing the floor of the mouth. It is a motion of distraction, distracting the patient's mind from the area of the contact of the sensor with the soft tissue. And speaking of this of distraction, always talk to the patient while placing the sensor, so that you distract the patient. Any subject, please open. Okay, very good. Even if he has not for children only. This is works with the adults. The patient will be trying to comprehend what you're saying to him. So his mind will be distracted from the sensor, especially if we are working gently, and then he will try to listen and try to answer back or behave back or do what you are asking him to do. So please keep talking to the patient while placing the sensor to distract him from the sensor placement. Keep talking to the patient in any subject. Preferably, okay, this is a long procedure, we are going to do a good job, especially with this x-ray, preferably talk, and anything. It's just a matter of distraction. And bring the x-ray after you place this, make sure that you have placed it in the correct position. Now, previously you have brought the cone close to the patient, now bring it and perform your angulation properly. Keep again talking to the patient. Go fast and expose. Okay, and then you ask the patient not to move. Please don't move. I'm doing the exposure. Click. Okay, and then after you've done the exposure, go back to your patient again. The idea is to keep the sensor the minimum time inside the patient's mouth. After you've done the exposure, again the same procedure, you're going to reverse what you have done, and then you are going to gently hold the sensor and remove it out from the oral cavity without sliding the sensor against the soft tissue. It's just a matter of holding the sensor, take it out, avoid touching anything. Gagging reflex will not occur. And if you have the chance to do, or if you have a panoramic machine, OPG machine in your clinic, and you feel that the patient is not cooperating, though you have followed those steps, I'm quite sure if you follow these steps, you will notice that there will be minimum gagging, if not at all. I've tried this several times, and the gagging reflex can be completely eliminated by being gentle and fast in your procedure. Doing a panoramic radiograph, we all know that a panoramic radiograph does not give the same resolution as that of the periapical radiograph. So please consider this, plus the exposure, the added exposure to the patient. So please let us stick to the periapical radiographs, which are better in terms of resolution. They are better in terms of patient exposure. If all these fail, and if you are treating a patient like grade 3, 4, and 5, then we have to go for a distraction. If the distraction fails, then we are going to take one of different methods, like we will work with medications, local and topical anesthetics on the soft palate. However, I do not prefer this, and tell you the truth, it seldom works. It doesn't work. If the patient has a gagging reflex and you are rough, or the patient is rough, the dentist or his assistant is rough during taking the radiograph, the local anesthetics will not work. It's a matter of being gentle to the patient. And if also this fails, like in severe gagging, then centrally acting agents like nitrous oxide and other diazepams and these things will work, but this is if you're doing an extensive procedure. You're not going to give centrally acting agents for simple procedures. And sometimes the acupuncture and the acupressure therapy works on the ears, in the center of the symphysial area, and sometimes pressure on this area will work. And I will talk about now in the next slide about the references. Those references are actually, if you want to go further into the types of the medications that are used and the courses of the nerves and what is involved in the process of the in the brain, what is going on in the brain, I would recommend those references. This is a very good reference for the innervation of the for the glossopharyngeal and the vagus and the trigeminal nerves. It's a very good article, and actually I've used most of the material from this article. And this is another article where it is going to talk about the medications that are used to control the severe type of gagging. And this is a nice article that will talk about the acupuncture and the acupressure, the Chinese medicine, if you would like to call it, and to control the gagging reflex. With this, I would like to recap. Gagging is a natural reflex that can be aggravated by touching certain areas. A dentist, if being gentle and know where the areas that to avoid, I think dentists and their assistants can reduce, if not eliminate, the gagging reflex totally. Thank you very much, and all the best.